name is Christy Land, and our presentation is going to be on asthma and acute bronchitis. The other two members of my group are Catherine G. and Bailey Parks. Let's get started. The table of contents start with the learning objectives, the definition, incidence, risk factors, diagnosis and prognosis, the impact on the individual, family, and society, the pathophysiology, the signs and symptoms, ethical issues, the plan of care, and of course the references. The learning objectives. The learner will be able to identify 3 risk factors for asthma by the end of the presentation. The learner will also be able to identify 3 risk factors for acute bronchitis by the end of the presentation. Next, the learner will be able to identify 3 diagnostic tests for asthma by the end of the presentation. The learner will also be able to identify 3 signs and symptoms of asthma, and also be able to identify 3 signs and symptoms of acute bronchitis. And lastly, the learner will be able to identify 3 triggers for asthma by the end of the presentation. The definition of asthma. Asthma is a respiratory condition marked by spasms in the bronchi of the lungs, causing a difficulty in breathing. It usually results from an allergic reaction or other forms of hypersensitivity conditions in which your airways narrow and swell and produces extra mucus, making breathing difficult, triggering coughing, wheezing, and shortness of breath. The definition for acute bronchitis. Acute bronchitis is the inflammation of the bronchi as a result of an infection, either viral or bacterial, or a chemical irritant. Some incidences of asthma and bronchitis. Asthma may occur at any age. It is more common in people under the age of 40. Asthma is diagnosed more frequently in children. Nearly 1 in 10 American children have asthma. As of 2013, an estimated 7.1 million children 18 and under have been diagnosed with this disease. According to the Center of Disease Control, in 2013, 18.9 million American adults, or 8.2 million, had asthma. Nearly 2 million emergency visits each year, and men are twice as likely as women to get asthma. Asthma is diagnosed more frequently in males 14 years of age, and the rate of childhood asthma has doubled since the 1980s. Risk factors. Some risk factors for asthma would be the genetics. Your mom or your dad had it. Allergies, being a smoker, occupational exposure, obesity, exposures to different types of pollution such as air pollution, and of course secondhand smoke exposure. Some risk factors for acute bronchitis would also be the occupational exposure, GERD, being a smoker or secondhand smoke exposure, and low resistance.